Hi, everyone, and welcome back to the Flourish Well podcast. It's our second episode. Happy Physical Therapy Month. Little did you know that October was PT month. So
Whoop, whoop.
we are celebrating today with a dear friend of mine, Julie Alvarez.
I have a new last name since we worked together. Yeah.
I know, and did I get it right?
You did not, but that was a good try.
I literally meant to practice this earlier.
No,
This
that's
is
okay. Yes, I am
it.
Julie Aviles.
Okay, I just
I'm
needed to have
Latina
more.
now, Naomi.
Yes, I love it. I love it so much.
My
Please
boyfriend's Puerto
forgive
Rican,
my
or
terrible
husband, sorry.
What?
I said my husband's Puerto Rican. That's where it comes from.
Yes. Forgive my awful pronunciation, Giovanni. I hope you still love me. Um, thank you so much, Julie, for joining me. I'm so excited to have you here.
Thank you. I am pumped to be here. It's been a little too long since we've had one of these chats back on my podcast this past spring. And so, yeah, excited to dive in today.
Yeah, so before we begin, a little bit of an introduction here. Julie is a female athlete and pelvic health specialist who I have had the pleasure of working with at our previous job. You can find her treating female athletes and pelvic floor conditions in Tennessee with Physiolab, and I hear things are going great there, so I'm glad to hear that. You can also find her on her podcast, which you just mentioned, Goal Set Mindset, talking about all things wellness, health, and self-improvement. To steal from Taylor Swift, because I love her, Julie is a human can I speak? A human exclamation point. She's just like such a joy. She's constantly in the pursuit of bettering herself as a wife, a clinician, and a human, while also bringing her particular brand of joy to every encounter. So thank you, Julie, for being here. I'm
That
so
is such
excited.
a sweet and thoughtful introduction, Naomi. I am so smiley right now over that. Thank you so much.
Especially with the pronunciation of exclamation point. I apparently just can't speak English
You
either.
know, words are hard, and words are hard at 5:30 p.m. So we're
So
just
true.
gonna go with it. I
We're
am
gonna roll
sipping
with the
on
punches.
a green tea right now, and so it's gonna give me a little bit of life.
I
At
love
least
that for
we hope
you.
so.
I love it. So, because it's PT month, I immediately thought of you, like I mentioned in my introduction there. I immediately thought of you. You're someone who, like, yes, technically I was the mentor, I guess, but like, really, I learned so much from you. And I just like really appreciate the attitude that you bring to your patient interactions, your interactions with colleagues. Like, I really look up to you in that sense. Like, I really think it's good to surround yourself with people who push you to be better, and you're one of those people. So I have a couple of PT related questions that I think will help other PTs, but also help patients. Um, it'll help PTs kind of like form their worldview of how am I like treating patients, how am I interacting with people in the clinic, but also gives patients an idea of what should I be looking out for in my PT. So to dive right into that, what's your mindset when you meet a new patient?
Yeah, yeah, I love that. Um, it definitely is a fun conversation, Naomi. I'm excited about this because I would consider. Yeah, I love this question because I think it is super important to really think thoroughly about how you're going to approach a patient when they're coming in for the first time. I've read in books before and heard from people that work in kind of the sales space or like the human interaction space that the first few minutes you spend with somebody is really important too. So one of the first things that's in my head as a reminder when I'm treating a client for the first time is to listen more than I speak.
Yeah,
And
that's
this
huge.
is challenging for me because I'm a talker, I'm a yapper, and that can be a gift at times, but it can also get me into some trouble. And I've just learned, as a clinician now for a few years, like I think when I first came out, I was so full of pressure to prove myself, to show how much I know, to make sure the patient thinks I'm smart because that's why they're going to trust me. And so we end up kind of overdoing it sometimes with like educating, or we just jump in too fast and we start going down rabbit holes about things that aren't super relevant to
Hmm.
either the case itself or to the patient. And so I think on that first session, we as PTs need to learn to kind of sit back and listen and create space for the person to really dive deep into why they're here. And we're going to have a range of personalities, right? I've got a client right now who's works in a very like data analytical type job. He's a numbers guy. He's very black and white, doesn't show a whole lot of emotion. Our question answer is very like question
Hmm.
answer.
Hmm.
But we've gotten pretty deep into why he's here and what he's hoping for, and you can get there. And then we've got, the mom of three who's finally out of the house for the first time in weeks, and she is ready to just spill the beans. And those are our girls. We love those girls. But we need to create space for that, and we need to let the patient know, hey, this is your hour. I want to hear from you. And I think
Hmm.
that's also what sets us apart from other medical providers, Naomi. Like when a patient leaves their session with me, I want them to think to themselves, wow, that was a different kind of interaction with the medical system
Hmm.
than I'm used to. And so I think a lot of that comes from creating space to listen really well.
Yeah, 100%. Um, yeah, especially with pelvic health patients, like you really need that time. I've had patients who, you know, the 45 minutes that we're together is spent just going through history. And it's going through history because they've had so many surgeries or they've seen so many doctors, or they just have a really long, and arduous journey up until this point, right? And it's important for us to hear all of those elements, right? Like you can do a special test, you can measure a joint, you can, grade, muscle strength, right? But that the subjective is really where you're going to get your meat. It's really where you're going to start having your hypotheses. And, at the end of your first day, you may not have the exact answer, but you're going to have a couple options, right, to run through, um, avenues to go down, right? And so hearing someone speak and actually absorbing what they're saying to you is critical. I totally agree.
Yeah, 100%. And I think like when I think of what we do as PTs and what we need to be excellent at to be successful, not only in our job, but like not only from like a hey, I need to be good so people come back, but also like to actually serve our humans well, is from a clinical standpoint, we need to know what we're doing. We need to get to the root of the problem and we need to pave the way forward. But also, it is so much more about building relationships than we think.
100%.
It is
100%.
so much more about the person enjoying spending that time with you than we think it
Hmm.
is,
Hmm.
because we're not taught that, and the medical system doesn't create that. So, yeah. And so, another thing that I really harp on in that first session, Naomi, is two questions that always come up that I make sure to create space to ask. And one of them is somewhat early in the session asking the patient, how can I best help you today? Like, we have 60 minutes together. How can I best serve you today in this session? And
Hmm.
hearing from them, because we'll be surprised sometimes if a patient comes in with pain and we might think, oh, they just want, soft tissue work, or they just want a list of exercises, or maybe we know a family member of theirs, or maybe we've even seen them before. And so we're creating these assumptions, and
Hmm.
the patient's like, I would really just love to know what you think might be going on. Or I would really just love to know, like, if you think I should get an x-ray. Or, like, we need to know what they want from us.
Hmm.
And sometimes people will look at you and be like, I mean, my knee hurts, so, like, I want my knee to not hurt. And it is that simple.
Yeah.
And I giggle a little and I say, that's a fabulous answer. We're going to make sure we look at and work on your knee today. Like, I'm going to give you some
Hmm.
treatment today.
Hmm.
And then the second question, Naomi, which I really try to make sure comes up in that first session, but sometimes it bleeds over into the second, is what would you like to get out of physical therapy? Like, when you think about success in this experience, what does that look like to you? What do you want to get out of working with me? Because again, that's going to range from a patient saying, hey, once my knee doesn't hurt anymore, I'm good. Or, hey,
Hmm.
once I can run 3 miles without peeing myself, I'm happy. But
Hmm.
you might also get an answer that's like, nobody's really asked me that. And like, I haven't run in 10 years, but like, I would really love to run. But like, that might be crazy. Like, it's okay if I can't. And like,
Hmm.
actually, like, my doctor probably told me I can't, but like, I would love that. And you
Yeah.
get that out of them. And then we get to take that and freaking run with
Hmm.
it and
Hmm.
go. So it is so important to let the patient speak. And not only that, but for us to really pull those key things out about what they're looking for.
Yeah, 100%. I love that. It's the rapport building, but it's also the like going back to the formulation of hypothesis, right? Like sometimes when someone's giving you their subjective, yes, it's just a list of facts. And sometimes that gets a little bit deeper into like some of like what's going on in their social structure, right? In their family structure. But that can also give you into clues of how their system is working as a whole, right? And those are big questions. And you can't necessarily just come out and say, hey, do you have an eating disorder? Right? Like most people are going to be like, I'm never seeing her again. Right? But
Yeah.
like we have ways to get around that question, right? Because that's important for us to know.
Yeah.
But we're just meeting this person for the first time. So why am I asking you that, right? Like
Yeah.
so anyway, just hearing exactly what they're saying. Yeah, I love that. And I love that you continue that on through follow-ups as well. Like that's really
Yeah. Yeah,
critical.
honestly, every session that a patient comes in, whether it's their second time or their seventh time seeing me, I've gotten into the routine of checking in with them. How was your weekend? How was Molly's softball game? How was your aunt's birthday party? Like try to remember things about the person
Mhm.
too, because that feels so special when we know their kid's name or their husband's name or what they do for work. But then asking them, you know, based on what you told me, I'm thinking we're going to reassess your knee, we're going to do some hands on work, and then we're going to update your exercises. But what would you like to get out of our session today? And
Okay.
sometimes patients feel a little weird about that question at first because nobody's ever asked them that. Like, what do you want out of this, Naomi? Like,
Yeah,
you're
yeah.
paying money. What do you want? And then when they come in, they're excited to be like, hey, would you actually mind like maybe checking out this shoulder thing I got going on
Yeah.
too? Or, hey, I really love the EMOM workout that you gave me last time. Like, could we maybe like do another one of those?
Love
And
that.
I would never know that they want that unless I ask them. So,
Right.
yes, we've got to create space for that.
It's such a provocative question, right? Like I'm thinking of a professor of mine in school and then we'll move on, but I'm thinking of a professor of mine in school who he would ask his patients, "Hey, like what does your body feel like it needs to do right now?"
Mm.
Can you imagine asking a patient that question? You know, like
I
that
think I
doesn't
think we'd get I think we'd get some fun variety of answers. That is a good question. I like that.
right, exactly. But he's like, the system is pretty intuitive, right? Like you know what you need. It's just how do
Yeah.
you advocate for it, right? So, anyway, I love that. Okay, so listening, going in with a mindset of hearing and absorbing what the patient is bringing to the table. Love
Yeah.
that. Awesome. What are your three top tidbits that you've learned from a colleague, either a PT or not a PT, that you wish every physical therapist implemented into their care?
Yeah. Yeah. This was a kind of a hard question to answer, Naomi, because, and I'm glad that you put a limit on it, or else I would just go, because I've had some amazing humans pour into me, yourself being one of them. But yeah, kind of came up with the top three that really live rent free in my head. I'd love to go through each one and kind of get some thoughts from you on them too, and then we'll
Love
kind of go
it.
through the list. But the first one I have here is pertaining to exercise prescription specifically. It also does kind of carry over into our exam and into our manual therapy that we might do. But I learned this from a PT named Lindsay Huey, who's a mentor of mine and a fantastic clinical education educator. And the quote is, do less better.
Hmm.
Like, we are so good at doing way too much. We love to print off a home exercise program that we found online that has 12 different exercises for your knee arthritis and give it to you. And before you know it, you've got a thick stapled packet that gets coffee spilled on it on your kitchen table. And you're like, I am not doing this thing. This is way too long. This is overwhelming. And not only are there so many exercises, but they're not even effective. Like a lot of times they are super low level, like not actually creating tissue change. And so the big message here is, as physical therapists, how can we do less things but do them better, do them
Hmm.
really well? And this is a big point specifically with prescribing exercises, which I think when I look at the physical therapy landscape as a whole, that's one of our biggest areas of weakness
Hmm.
is underdosing and underloading our patients. And
100%.
we'll continue to talk about this as we go through because it comes up in some other things for me too. But yeah, I mean, as a PT, when we do our assessment, we're thorough, we're patient, we listen to the subjective complaints, we write them down, we measure them subjectively, like getting as many details as possible. We should be able to kind of push the clouds away a little bit and laser focus on like what is the lowest hanging fruit that this patient needs, like what is the most limited mobility point, or what is the most irritable tissue, or what is the biggest area of weakness on their body, and let's go after that, and like let's keep it simple.
Mm-hmm.
So in practice, what that looks like for me, Naomi, is when I'm building a home exercise program for a patient, I really try to stick to no more than 4 exercises. Most times on eval, I'll give them 2 things to get started with, because to
Mm-hmm.
be honest, we didn't spend a whole lot of time looking at that stuff, because we talked a lot, we listened a lot. We let them know that next time you come in, we are picking up right where we left off, and we are going to figure this thing out. And I
Mm-hmm.
let them know what I'm thinking already. I'm saying, hey, like I had a client come in last week for prolapse symptoms. She had a prolapse surgery. She's
Mm-hmm.
58 years old. She's had symptoms for years. She's been told all these crazy things by all these doctors. She was very hesitant to come and see me because she's tried pelvic PT and it hasn't worked. And when she came in, we spoke for a long time. We got that long history. But I asked her questions about her symptoms that nobody's asked her. And I said to her, hey, we're going to go ahead and do our internal exam on the next session, and that's really going to give us the info that we need. But what it sounds like to me is that we have an endurance, a fatigue-based problem right now.
Mm-hmm.
I love that you can go out for a 2-mile walk and you feel pretty good, but once you cross that line, that's when your symptoms come back. And so we're going to have to rebuild some capacity. You told me you're doing a lightweight, high rep lifting program like all the girlies do. And, I think we can maybe load you a little heavier, even though that's something you've been told that you can't do. I would love to explore that with you. And so I share with them where my thoughts are at, with that asterisk sign of like, hey, we're not done. We're not done investigating this yet. But they have this sense of relief of like, oh, she's listening, she's processing, she's putting the pieces together. And I haven't really put my hands on her very much, so I'm going to give her a couple of things that I know are going to move the needle in the right direction.
Mm-hmm.
I gave that specific client an adductor stretch, and I taught her how to breathe. And that she was happy about that. She was excited about that.
Yep. Yep.
And so then she came in for her next session, and then I took that same 2 things I gave her, and I tacked on 2 more. And I said,
Mm-hmm.
hey, we're going to circuit this. And so all that to say, I think that we overcomplicate some things sometimes,
Mm-hmm.
and doing things simple but better
Mm-hmm.
is the way to go.
Well, and to your point about underloading, right? Like I think of like what I'm sure I did when I worked for, the big name PT companies like previously, right, that are nationwide. I was definitely giving people 10 to 20 exercises to go home and do, right? And that's kind of like standard of care. It's like what you're expected to do in school. You're expected to have this whole long list of things that right? And you're in practical mindset. So you're like, I'm going to just like word vomit on you everything that I've ever learned about a knee ever in my entire life or about a prolapse in my entire life. But when you're underdosing a patient, you need that to have any kind of a change. You need a million different ways of treating the same problem, right? But if you're properly loading someone and actually challenging them, it's amazing how much quicker their tissues actually respond. And also, it makes the workout shorter.
Yeah.
Right? So, yeah, it's something I wish, like, I had only 1 semester of exercise science in school in my entire 6 years, which feels like a travesty. I mean, it certainly is a travesty, right? Like, everything I've had to learn has been after the fact. So, yeah, it's definitely a room for improvement. I love that.
Yeah, yeah. And
A
again,
bit.
to clinicians that are listening, if you're listening to this and you're like, man, I don't know if I feel confident in my exercise prescription, there are so many ways to go and learn, but you have to take ownership of that and go out
Mhm.
there and learn. I think any good PT will tell you that what's made them a good clinician is not the things that they learned in their doctoral program, because you know what our doctoral program is for? It is to prepare us to pass the licensing exam,
Mhm.
which is very black and white, very medicalized, and about 15 years outdated. And
Yeah.
again, that's just the way it is. That's the point of school.
Mhm.
And also it's to make sure we don't kill anybody, and that's
Right.
really great and really important. Anything beyond that that's going to make you excellent, you've got to take ownership. Go and learn from strength and conditioning professionals. Go and
Mhm.
spend time with personal trainers who know how to cue and coach and develop a program. And find continuing education courses where they actually use weights. Like,
Right.
do some research and see, oh, this is being held in a gym. Okay, I'm actually going to learn something
Mm-hmm.
about fitness, in here. And so if anybody's listening to this and is interested in this, shoot me a message on Instagram, Julie Aviles DPT. Naomi will, I'm sure, put it in the description.
I
But
will.
I'm very passionate about it because I don't like to speak about this topic in a way of like, all of us PTs, all you PTs out there, you're dumb. It's like, no, we just haven't been guided enough and correctly. So yes, I'm glad to hear you kind of echo that. And again, I think back to myself in the beginning, and I was not good at this, and I'm still learning how to be better at
Hmm.
this. But yeah, you
It's a
got to kind of
practice.
just take ownership of it.
Yeah, 100%.
Yeah,
So number one, exercise prescription. What's number
yeah,
two?
do less better. Number two is a quote from Dr. Jeff Moore, who works for the same continuing education company as Lindsay Huey. I'm going to plug the Institute of Clinical Excellence because they have taught me a lot of what I know, and he's been a tremendous mentor as well. But one of the quotes that he said in the lumbar spine course that I took was in reference to creating plans of care and actually moving through physical therapy with a client. And the quote is, it's not our patient's job to know if they're getting better. It's our job to show them. I'm going to say that
Mm-hmm.
again. It's not our patient's job to know if they're getting better. It's our job to show them. And when we
Mm-hmm.
first hear that as PTs, it's like, oh, well, what do you mean? They should know if they're getting better? But when we have clients who come in and we ask them, how'd you feel? How are things going? So many people are like, oh, I think maybe it's a little better. And if their progress is slow and if it's subtle, they're going to fall off the bandwagon of being bought in very quickly. It is
Mm-hmm.
our job to assess what's meaningful to them, what actually matters, what's actually a problem, measure it, track it. And when they
Mm-hmm.
come in, we either retest an objective measure or we ask them about a subjective measure.
Mm-hmm.
And this could range from going back to a pelvic floor example. I had a client come in earlier this year, mama of three. Her youngest baby is about 2 years old. She signed up for the Knoxville Half Marathon. She hasn't run in years, but she was a runner her whole life, and she was experiencing stress urinary incontinence with running, amongst other things. And she came in and was having pretty frequent symptoms. And so we did our external assessment first. We then did our internal assessment on day two. Some of the things we found was she's pretty weak in her hips, glute strength, hip abduction strength, hip flexor strength, kind of all of it. And also, subjectively, she was experiencing leaking worse with hills, whether it was uphill
Mm-hmm.
or downhill. And so we kind of had these two things we were tracking, like running on hills or quick accelerations. And then
Mm-hmm.
also, hey, we're working on your hip strength. And so when she comes in, we're going to look at both of those things. And I am going to manually muscle test her hip abduction and I'm going to resist her. And I'm going to say, how did that feel to you? And she's like, I think that's a little stronger. And I'm like, I agree with you, Lauren, because it actually was.
Yeah.
And then we talk about the run. And she says, yeah, I had a 6 mile run this weekend. And I say, how'd it go? And she's like, I leaked twice. And I said, okay, honestly, that's good, Lauren. Like, can you tell me a little bit more about when that happened? And she's like, well, the first one, let me think. Okay, I was at this intersection. I was listening to this podcast. It was about mile 4. And I'm like,
That's
mile
awesome.
4, sister? And she's like, yeah, mile 4. I'm like, Lauren, that's awesome. Like that means that your pelvic floor was able to maintain some
Mm-hmm.
some strength and some robustness 40
Mm-hmm.
minutes into your run. That's amazing. And she looked at me and was like, and her shoulders kind of dropped a little and she's like, oh, cool. Because in her mind, she's still getting symptoms. And is that relevant? Yes. Are we done
Yes.
yet? No. But are we freaking pumped that she did not experience leaking until 40 minutes in compared to 5 minutes in?
Mm-hmm.
Hell yeah, we are pumped about that and we're going to
Mm-hmm.
celebrate that. So
Mm-hmm.
that's an example of we need to show them, we need to guide that thought process. And it's not to make ourselves look good, it's to show them that
Right.
they're capable,
Yeah.
that I'm not fixing you. You
You
are
are
healing
fixing
you.
it.
You are doing the work. I'm just walking with you, you know?
Mm-hmm.
So this concept is one that I absolutely love.
And in my mind, that's like setting proper benchmarks, right?
Mm-hmm.
Yes, it's the retesting every time. It's setting proper benchmarks and then celebrating when those benchmarks are achieved, right? Because how often, like, I can think of like maybe one scenario where you walk into a doctor's office and they go, "Oh my God, this is incredible." Like I think of all those IVF videos that I see online, right? Where the doctor is calling the patient and says, "Hey, you're pregnant. That's incredible. Like this is awesome." And they're celebrating, right? Like we don't do that. We don't do that. We don't do that when somebody's like diabetes is well managed, right? Like these are other areas that we could be celebrating people that are meaningful, right? Because that's a
Yeah.
huge change in someone's life,
Yeah.
right?
Yeah. And when we think of the big why, Naomi, of like, as physical therapists, what keeps the passion? What keeps the fire? It's like it's making a real difference for people, not just in the span of time that they're seeing us,
Mm-hmm.
but to equip them with principles and knowledge and a mindset that's going to carry them forward. Like it's
Hmm.
bringing awareness to these things. We live our lives so much on autopilot that so many of us don't even check in with our body and
Right.
how we're feeling and how we're doing. And no wonder why our patients have no clue if they're broken, if they're not, if they're better, if they're not, because we don't spend time to evaluate it. And so by us simply coaching somebody through that and teaching them how to do that, I mean, the value that that's going to have for them long later in life is huge, you know?
Mm-hmm.
So,
100%.
yeah.
Love that. Love it.
Yeah.
Okay, so we have less is better, do less better, sorry, and show them, right? Show them how they're doing. So what's number three?
Yeah. Yeah. And then my last one here is let's not shy away from talking about things and asking about things that are more so on the boundaries of the work that we do as a physical therapist. What I mean by that is that when we talk about treating the whole person, treating the whole human, we have to talk about sleep and stress and nutrition. And notice how I'm simply using the word talk. That's the verb I'm going to say.
Mm-hmm.
We need to bring it up. We need to ask about it. We need to evaluate where on the spectrum from like total dysfunction, not sleeping at all, or red lights going off, this is giving eating disorder,
Hmm.
or stress out the wazoo, anxiety, depression, all the way to like, hey, they're doing well in these categories. Most people are going to be somewhere in the middle. Like there is somewhere along those sliding scales that the needle can be moved forward. And as movement professionals, as health and wellness professionals, all the things that we call ourselves as PTs, it is very much within our scope and within
Hmm.
our wheelhouse
Hmm.
to educate on these things, to guide, to ask questions, and ultimately to be a resource dealer. So that if somebody does need an expert, we can send them that way. We've got
100%.
people.
Yep.
But so many PTs are afraid to ask about these things, specifically nutrition and mental health.
Hmm.
I think we feel awkward about it. We are nervous because that's not our expertise. We're scared to step on toes. But also, like, what are we really afraid of? Like, patients need to be thinking about this, need to be asked about this, and who better than us
Hmm.
to start that conversation? Somebody that they trust, somebody that they're seeing regularly, somebody that's trying to help them get fitter and healthier.
Hmm. Hmm. Yeah, I'll never forget having a conversation with a patient. This was a couple years ago when I had just started out with pelvic health. And she and I had had a long conversation. There were a lot of life changes that were going on, and her stress level was super high, and her symptoms were not really changing. Like they were kind of staying the same. We had made some small gains and stuff. And I think it was after a couple sessions, I just looked at her and I was like, I'm concerned about your level of stress. Like, I really am worried about you. And she's like, what do you mean? And I was like, you've got a lot going on, and it doesn't sound like you have a lot of support with that. And I think that that's an area that we need to like work on. And so here are some resources for you for that if you're open to them. And she was like, yeah, I'm open to that. And she's been in therapy to this day, right? And it's been a huge help to her. And she's out of
Yeah.
my care now, right? Like she's in the care of her therapist, and her body is feeling better.
Yeah.
Um, so sometimes that is the missing link. And
Yeah.
also, there's so many things that we can detect, right? And just like you're saying, refer out, right?
Yeah. Yeah, definitely. And just that provides a whole nother level of patients feeling like we really care about them
Mhm.
because we want to know about these things. I mean, so many of our perimenopausal clients that are experiencing pelvic floor problems that come into our office for leaking or pain or prolapse are also experiencing sleep disturbances. And
Yep.
even just talking about it and saying, hey, a lot of women experience this around this time. It's not just you. You're not
Hmm.
broken.
Hmm.
If you are interested in some strategies to help to improve sleep quality, I would love to discuss that with you.
Yeah.
And planting the seed and leave it up to them to be like, yeah, I would love that. Or like, hey, I'm good for now, but like, thank you for mentioning it, you know? Yeah,
Yeah.
it's super important. And on the stress topic, Naomi, like kind of detecting that, a personal story of mine and a big thing that's influenced my journey as a clinician is my own experience in pelvic floor PT. It was about this time 3 years ago. I was pretty new in my career as a physical therapist. I had just moved to Maryland, brand new state, didn't know anybody, moved in with my boyfriend. I'm working as a PT for the first time. All the things that I've ever wanted are happening, but also there was a lot going on. And I started to experience pelvic pain, pelvic floor, tightness symptoms.
Hmm.
Knew enough to know that I should go to a PT. Took me a long time to finally give a call, but I went. And
Hmm.
about 2 or 3 sessions in, my physical therapist, Ashlyn Parker, love her to death. She's up in Sparks, Maryland, and changed my life. So shout out to her. There was one session where we're talking about work and about all these things, and I was doing my podcast at the time, and she goes, Julie, like, it sounds like you have a lot on your plate. And I was like, yeah, I mean, I guess so, but like, I'm so happy. Like, everything's so great. Like, work's great. My boyfriend's great. I'm doing CrossFit. It's great. Everything's great.
It's so
Like
good.
2019, Julie would be beaming over all of this. And
Hmm.
she goes, yeah, and I'm so happy to hear that. But even good stress is still stress. Like,
Hmm.
even good and happy and exciting things that you're doing are still
Hmm.
things that you're doing.
Yep.
And she just kind of gave permission to be like, hey, like, you're doing a lot. And over the course of getting to know her, there was a session where I just like broke down and cried. And it took me by surprise because I was like, I was embarrassed, first of all, which if you're a patient, you're listening to this, let it go, let it rip. We are here for it because
I
we,
have
we
so many
want this
people.
experience for
Right.
you. But we got the tissues in the corner, we're good.
Hmm.
But
Hmm.
I was I was like apologizing. I was like, I'm so sorry. I'm like, honestly, I never thought about that. And so all that to say, she just became such a great leader and guide for me on taking care of myself mentally and
Hmm.
giving me permission to do that. And so it is important to ask about it because, again, on paper, I was killing it, right? I was like living my dream. I was doing all the things that I wanted to do, but I was still struggling and my body was holding that tension.
Yep.
Um, and so, yeah, as PTs, like that might be why your patient is stalling in progress. That might be why they come in and their shoulder is still jacked up because
Hmm.
there's a nervous system problem there.
Hmm.
And we can help with that. We
100%.
can help with that by at least asking about it and bringing awareness to it.
Yeah, I love that. So the three tidbits: do less better. Our job is to show them. And then also ask the fringe questions. I love that. I love all those. 10
Yeah.
out of 10.
Thanks, Naomi.
Love it. You get a gold star. um,
Amazing.
yay. What are some recommendations you give to every patient, regardless of diagnosis?
Yeah. Another awesome question. So, some of the overarching things for me are one of them, going back to the exercise conversation, is to be very intentional with your exercises. And what I mean by that is kind of circling back to this mindless way that we tend to go about our day to day. We live in a very multitasking culture. And many of us try to do multiple things at the same time, right? So you might be like, oh, let me do my exercises, while my food's in the microwave and I'm on a Zoom call for work and I'm doing all these things. And yeah, it's just a stretch. Like, let me just knock it out. And almost all of the time, your focus, your attention, you're checking in on how it's feeling, all of that is going to make a big difference as to whether or not the things are successful.
Hmm.
Whether it's a mobility drill, whether it's a strength drill, your physical therapist should be explaining to you where you should feel it, what it should feel like, what's the
Hmm.
goal of this exercise. When I get to the end of this set of 8 or 10 or a 30-second hold, what should I be feeling? Ask
Mhm.
that question and assess for that, because we are not going to know if your exercises are being effective if you're not being intentional about it.
Yeah.
And it's also on us as the physical therapist to be intentional with our prescription. Let's not just 3 sets of 10 everything for the hell of it. Let's
Mhm.
program rest breaks. Let's program RPE. Like, let's tell them how hard it should be, you know?
Mhm.
So that's a big one, is being intentional. And then kind of secondary to that is tracking your symptoms. So I love to tell my clients, like, I most of my clients I see on a weekly basis, a once a week basis. Some go a little bit further than that, some come twice a week. But when I'm wrapping up a session with my patient, I always say to them, hey, I want to hear how you're feeling after today. And I also want to hear how your exercises went. And I've
Mhm.
got two options for you. You can either shoot me a message, you can text me anytime. It's not going to bother me. I will answer you when I can. Or
Mhm.
if you're just kind of dropping a little note of like, hey, finished my exercises, adductor stretch felt amazing, but the core exercise was kind of tricky. I'm not sure if I was set up right. I
Mhm.
might not respond to that, but I have that note for next time so that when you walk in
Mhm.
the door, I can say, hey, Naomi, so glad that adductor stretch felt good. Tell me more about that core exercise. Some of my clients opt to create a note in their phone and literally call it physical therapy and keep a little log of how you're
Mhm.
doing. You and I know in the pelvic floor space, this is crucial to kind of
Mhm.
log your symptoms, because it's pretty much all subjective, is like what we're working with.
Yep.
So I'm very, very big on, like, when you come in to see me, I want to know how things went. And I don't just want good, I want to hear about
Mhm.
it. And
Mhm.
listen, if you didn't get your exercises done, if life was crazy, if we're not there yet, that's okay. I'm not going to shame
Yeah, yeah,
you.
yeah.
But track it.
Yeah. This has been an area of growth for me with patients is when you come to see me, I'm seeing people like twice a month, once a month, like that kind of thing. And you get a month-long program like written from me with weekly check-ins, right? So like number one, having to be really intentional and also be able to assess like, how are symptoms changing like with what my patient is giving back to me? Um, like I had an instance today. I have this guy who's coming to see me for testicular pain. But he's also had issues with deadlifting on and off for like 10 or 15 years, like a long time. And in my mind, he's been in rehab for 6 months, doing like back rehab, right? And now just seeing me because they're like, we don't really know what to do with you anymore. Like, go talk to a pelvic floor PT about your testicular pain. Um, I gave him seated good mornings because I was like, hey, I'm expecting that your fear avoidance is pretty high for this movement. I'm guessing that you're underloaded in this hinge pattern, and so we're gonna do it in a really approachable way. Well, time goes on, da 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 da. It ends up being 6 weeks that I see him because of illness. Well, he comes in, he goes, that was really, what's the point of that? I was like, what do you mean? He goes, I mean, it's like a mobility exercise and that's fine, but like, I really didn't feel anything. I'm like, well, I'm like, I'm just chuffed over here. Like, this is great because I was expecting you to be like, oh, I was really like, I was nervous the first time I did it, da da da, whatever. Like, but he was able to do it with weight today, you know? So it's building back that and also giving that long explanation of, hey, this is why I'm like choosing this exercise for you. And this is the, reasoning and da da da, and this is the plan long term. You can tell me if it's too little because I need to know that. It's
Yeah.
important for you.
Yeah, and I love that you're mentioning that, Naomi, because it takes a very healthy level of humility as a physical therapist to be willing to hear from a patient, hey, that actually didn't hit the nail on the head. That
Yeah.
was way too easy, or that was way too hard.
Yep.
Honestly, you know that you're doing it right in loading patients and in
Mm-hmm.
prescribing exercises when you've got a few patients who you flare up. And
Mm-hmm. Right.
that might be like a hot take, and it sucks. It sucks when a client
Yeah.
comes in and they're like, honestly, Julie, that sideline eccentric external rotation, like my shoulder hurt for 2 days. And I'm like, I'm sorry to hear that. as we are working through this, we are playing around with this recipe and this chemistry of all these different exercises working together. And sometimes we overdo it and we're going to pull back. Thank you for letting me know.
Yeah.
And it sucks. I'm not excited
Hmm.
about that,
Yeah.
but like we need to be willing to miss the mark. We need to be willing to get
Sure.
feedback from our clients.
Hmm.
And again, that's where trust is going to be built in because how many people go back to a provider of theirs with a complaint and actually get something changed or corrected? Like
Right.
so many people are just dismissed and say, "Oh, just wait a little longer. Oh, sorry, that's all we do. Oh, sorry, that's all we have. Oh,
Yep.
sorry, no more of
Yep.
this." But for us to say, "Oh, thank you for letting me know. We're gonna adjust that a little bit." It's super important.
Yeah. I love that. Okay. So intentional exercise and being
Yeah.
intentional as a patient. I love that.
Yeah, being intentional, tracking, and just having open communication about it. And then the last thing that I had listed here, Naomi, I mentioned this earlier, but giving permission to my clients to dream. Like
Hmm.
giving them space and permission to be like, what are we working towards? What do you want out of this? And again, we can't expect a big answer out of all of our clients on day one or day two or day three. But once that back pain starts to melt away, or once they start to exercise without leaking, or once that sciatic pain is like a 2 out of 10 instead of an 8 out of 10, now their brain is going to allow them to start to dream about what's possible.
Yeah.
Let's create space for that. Let's ask them, if this problem wasn't holding you back anymore, what would success look like to you 6 months from now? What are we doing in April?
Right. Right.
And sometimes they will literally be like, I don't know. I don't even know what I'm eating for breakfast tomorrow.
Yeah. Yeah.
But ask it again, be vulnerable. And at
Hmm.
some point, I can promise you they're going to come to you and be like, I actually was
Hmm.
thinking about it and this might be crazy. And you're going to lean
Right.
in a little and be like, tell me more. And we're going to go for it. And it's
Yeah.
freaking
Yeah.
awesome.
100%. 100%. Yeah. Our job, like, and our ability not being in the like standard space, like the standard health space, is to be able to get that like final 10%, right? Like, I'll never forget my like new grad um orientation at my first job and then being like, yeah, yeah, just get them to 80%. Boggles the mind, right?
Pain. Pain.
Right, exactly. So I love that we get the opportunity to train that out of them. Love it.
Yeah.
All right, final question here. How do people bridge the gap between rehab and fitness, both from a patient perspective, like how can they do that, and from a PT perspective, how can they do that?
Yeah, great question, and one that I love to answer and love to talk about. And so, to kind of like simplify things here, let's talk about the patient side first. I think if you're a patient and you truly want that bridge, you truly want to be challenged more. You've had PT before and you went 2 times a week for 6 weeks and it sucked because you didn't do anything that
Mm-hmm.
actually felt like anything. If that's you, you've got to come to physical therapy ready to work. You've got to be willing
Mm-hmm.
to work hard, wear some gym clothes, bring your water bottle, eat something before you come, maybe have a little electrolytes. Like, show up. And not every workout, not every session's going to feel like a workout, but when you come in and you have just that energy about you of like, I'm excited to work, it's going to make it a lot easier for your PT to jump in with you on that.
Mm-hmm.
Because as PTs, we are so fearful of doing too much or overdoing it or making a patient nervous or anything. So when you come in with that expectation, it's super, super helpful. And then also when you're looking for a physical therapist, look around the room. Make sure they've got some stuff that can actually get you fitter. I'm
Mm-hmm.
super privileged. I've worked in now three different spaces for three different companies, and I have never not had access to barbells and heavy kettlebells and medicine balls and turf. And I've always been able to throw heavy shit around. And I
Mm-hmm.
love that. And that's always been a non-negotiable for me because
Yeah.
I am a gym bro at heart. So, if you have only had physical therapy where they've got a colorful stack of dumbbells that go from 1 to 10 pounds and a whole bunch of TheraBands hanging from the ceiling, and that's all they got, and maybe a knee extension machine, cool, we can work with
Yep.
that.
Yep.
And a
Yep.
cable column, we can work with that.
Mm-hmm.
But does your PT know how to work with that? I don't know. Maybe they do, maybe they don't. interview your PTs, like find a place
Mhm.
that's actually going to be a good fit for you. And then we can get
Mhm.
into a whole nother conversation about, unfortunately, a lot of the in-network providers just don't have the resources. The companies don't invest in it. And so that's
Yep.
where out of network comes in, which Naomi, if you ever want to have a conversation about, being in the out of network space too, and some of that, would love to chat about that
Yeah,
sometime,
that'd be awesome.
as I've worked in both. But all that to say, make sure your facility actually has what you need to get fitter. And if they
Mhm.
don't, and you love your physical therapist, make sure they're giving you something to take into your own fitness facility.
Mhm.
Maybe it's Planet Fitness, or maybe it's the CrossFit gym, or maybe it's the kettlebell in your basement, but like take advantage of the resources that you have.
Yeah.
On the patient side, I think that's a really important, action step.
Yeah. I had a funny moment. It was someone got my mail delivered to them here in my clinic, and she walked in, and we were having a conversation, and I was like, "Yeah, yeah, like I do PT." And she's like looking around, and she goes, "Oh." She like sees my squat rack and my like barbell and everything, and she goes, "Oh, okay." I'm like, "Yeah, I do PT, and you're gonna get real weight here. Like that's the way it works." So anyway, great.
Yeah.
I love that. Yeah. Looking
Yeah.
for great space, looking for being ready to work. Yeah.
Yeah,
Huge.
definitely. Also, my cat just entered the chat and is meowing. So if you hear
Hi.
him,
Oh my
I
God.
gotta show you Mocha. I'm a very proud cat mom. Um, he's upset because he was locked out, but my husband just let him in, so now he's scratching. Anyway, let's
So,
wrap
from
this
a
up here.
PT perspective,
So yeah, from a PT perspective, Naomi, we need to dose intensity for our clients. We need to actually challenge them. And I think that the most important principle to actually put this into practice is to utilize RPE, rate of perceived exertion. I think that, again, as physical therapists, we tend to be pretty book smart people. We're a little analytical. We like to have a plan. We like to know exactly what weight and how many reps and sets. However, the really cool thing about fitness, and the really cool thing about the literature on building strength and specifically building hypertrophy, is that we're actually seeing that there's no magic method. There's no perfect sets and reps and intensity scheme, as much as we would all love that. And there have been millions of dollars spent on studies to try to discover, is it 4 sets of 12? Is it 3 sets of 8? Is it 70%? And what we're finding in the literature is it doesn't really freaking matter how
it
heavy the weight is
depends.
or how many reps you're doing. What
Yeah.
matters is how hard it is.
Yeah.
They've
Yeah.
done studies where they have some people lifting, doing, let's say, bench press with 45-pound barbell versus doing bench press with a 200-pound barbell. And the people who are doing a 45-pound barbell are going to 8 out of 10 fatigue. And what that means is they're going, they're going, they're going. It's easy. It starts to get hard. They're struggling. The last one's a
Mhm.
little ugly, and they've maybe got 2 left in the tank, and that's it.
Mhm.
The person with the empty barbell might get 40 reps. The dude benching or the girl benching 200, she might only get 5 reps. But if she's also getting to 8 out of 10 on that intensity scale, they're going
Mhm.
to have similar gains. And so the reason that I share that is because as physical therapists, if you don't have either the confidence or the accessibility to heavy stuff, you can still make things hard and intense with lighter load. You can use tempo. You can
Mhm.
use short rest breaks. We can incorporate supersets. You can
Mhm.
have them go right from a heavy dumbbell goblet squat where they're taking 5 seconds to get to the bottom, which is so slow and awful if you've ever done that. And then immediately after finishing that, they go into some like reverse lunges or maybe like broad jumps, or we make it hard by doing more things in a short amount of time. I
Mhm.
use supersets with pretty much all of my like fitness based clientele because it is so powerful in creating that fitness stimulus.
Yeah.
So that's kind of my technical answer there. And then I want to give you more of a non technical of how do we bridge this gap. We need to make it fun, Naomi. We need to get rid of this sterile white coat environment with khakis and
Mhm.
polos that the physical therapy world is, and we need to make it feel like fitness. If you truly want to dose fitness for your clients and you want them to have a fitness experience, it goes beyond having a 60-pound dumbbell and turf. Create that environment. Talk to
Mhm.
them like you're in the gym. Have a little
Mhm.
fun. Loosen up
Mhm.
a little. Laugh a little.
Mhm.
Maybe throw out a cuss word depending on where you're living in the country because That actually isn't going over so well in Knoxville, Tennessee, but we're working on it. um, put music on that's fun. Let's not
Yeah.
just listen to the 100.7
Mm-hmm. Mm-hmm.
radio
Light
station.
FM. Yeah, yeah.
Yeah, like these little things. I
Yeah.
want somebody to walk in and be like, "Oh, this is different. This is fun. This is fitness. This is the gym."
Mm-hmm.
Um, and also, can we hype our patients up? Can
100%.
we hype our patients up? Can we not be embarrassed to be like, Karen, that was the best squat I've seen out of you in 3 weeks. That was
Mm-hmm.
awesome.
Mm-hmm.
I don't care if she looks at you like you're crazy. That's going to mean something to her. She's going to go home and tell her husband over dinner, hey, my PT said that my squat looked really good today.
Mm-hmm.
And she might
Mm-hmm.
be real chill on the outside, but you know that is hitting her heart on the inside.
Yep.
Let's get a little weird like that. Like, let's
100%.
be hyped up. Make your patient feel like a badass. Give him a high five. Give him a fist bump. Can we just like be cooler? Can we just be cooler? You know? I'm not saying I'm cool. I'm kind of cringy sometimes, but
No,
like
you're my kind of cool. It's
that's
fine.
that's like huge takeaway. Like
Yeah,
make it
yeah.
fun, guys. Let's have a
100%.
little fun.
100%. I would add to that, um, teaching your patients how to take up space in a gym setting. I think that's huge, right? Like, I was not someone who had ever really used a squat rack before PT school, um, even though my brother's a power lifter. So teaching them like, hey, this is how you like set up a bar. This is how you like figure out your weights. This is how you like do all these pieces, right? Like they're intuitive to us because it's our job, but it's not intuitive to them, you know? Like my
Yeah.
mom is in her 50s and she loves trap bar deadlifts. And she loves trap bar deadlifts because my brother was like, you're going to do it right now.
Hell
Right?
yeah.
And here's how you do it, right? And she's like ready to trap bar deadlift whenever.
Let's go. What's your mom's name?
Roxanne.
Fire me up, Roxanne. I love that.
Yeah, it's great. It's awesome. And more people need to be like that, right? Like,
Yeah,
and
and
that require
and that's such a good point, Naomi, is also like it doesn't need to look sexy. Like
no,
it doesn't need to be complicated. It does not
no.
need to be a 135-pound deadlift.
Hmm.
Karen might be lifting an 18-pound kettlebell, but
Yep.
she was so afraid of that, and we made it feel
Hmm.
comfortable, and we said, hey,
Hmm.
just try it. We're going to celebrate that just as hard, honestly, probably even harder than my dude who is back squatting 225 for the first time after his disc herniation because he was
Yep.
already doing that. Like,
Hmm.
you're exactly right. Let's meet our people where they're
Yeah.
at, make
Yeah.
it comfortable, but once they cross that barrier,
Yeah.
make it like celebrate it.
Hmm.
Celebrate it
100%.
hard.
100%. So, what I'm getting from today is we need to listen more. We need to dose appropriately. We need to have joy. We all need to be the human exclamation point for our patient. That's what I'm hearing. Does that sound about right?
Amen. Amen.
Yeah. Any final thoughts, Jules?
No, this was a lot of fun, Naomi. Thank you so much for having me on. And
Yeah.
yeah, we work in a hard profession. It's nuanced, it's tough. We're always learning. The more that you learn, the more you realize you have to learn. I would be lying if I said that I was a very confident physical therapist right now. Like we're always growing.
Hmm.
But yeah, I think that some of these basic principles can go a long way. And I'm excited, for us as PTs to continue to collaborate with each other, conversations like this, remembering that we're all fighting the same fight. We're
Hmm.
not enemies of each other. We are
Yep.
all fighting the same fight and on the same side of the health and wellness promoting space. And so let's continue to collaborate.
100%. I love it, Julie. I miss you so much. I'm so glad I still get to talk to you. Keep being amazing.
Thanks, girl. I miss you too. Next time
Yeah.
I am up in Baltimore, I'm coming by the clinic. I can't wait to see it. So proud of you.
Yay! You're the best. That's it for today on Flourish Well. Thanks for tuning in as we grow, reflect, and move toward a more intentional, well balanced life. In honor of Physical Therapy Month, here's your gentle reminder. Your body was made to move, and healing takes time, so give yourself grace. If you've been putting off that ache, injury, or movement goal, now's the time to take the first step. Book that physical therapy consult or reach out to your trusted PT. If this episode resonated with you, share it with someone who might need a little encouragement too. And remember, flourishing isn't about perfection, it's about progress. Stay grounded, keep moving, and I'll see you next time.